Sunshine's Corner, being brought to you by Quint and Richie Studer.
And good morning, ladies and gentlemen. Welcome into the hottest spot in town. I can't believe it's already Thursday, but the time goes by so fast. Welcome into Sunshine's Corner, where we are committed to keeping you informed. Today, we are shining our light on something that can truly save lives. Early detection, you've heard it before. It truly does make a difference. It saves lives. Joining me today, Thursday, two incredible guests. Dr. Justice. I'm not going to mess up your last name, but you heard me talk about Dr. Justice. He's a professor and a doctor of PhD out at University of West Florida. And we've got Dr. Lucerne Wiley, a courageous cancer survivor that's going to be here with all the work that she does in the community. We're going to bring all that together. They will be sharing vital information about why early detection matters and how it can make all the difference when it comes to breast cancer awareness. When it comes to any cancer awareness, as a matter of fact, the awareness is for prevention. Early detection saves lives. And not only, this program is also hosting a mobile mammography that's coming into, this event that's coming into Pensacola. I want you to get a pen and mark this date down. It's going to be on Tuesday, May the 20th.
Wednesday.
Okay, on Wednesday, well, I got that wrong. I got it up on the screen there, ladies and gentlemen. You see that with my intro. It's going to be at 1718 East Olive Road from 8 a.m. to 5 p.m. We're going to talk about that today. And if you want to find out if you qualify, be sure to call this number, 850-316-2706. This is the conversation that we're having today because it is so utterly important. I see Dr. Justice, you got all your calendars. Thank you, Katie. You got all those calendar so we can see how to use this and find out things. Yes, and Dr. Wiley, thank you for coming in as always, because you are such a pillar in this community. But Dr. Justice,
good morning. Tell
me, first of all, I know you get out there and you work so hard.
Yes.
You work so hard. I call you, I try to do your accent. I wish I had it.
You didn't go ahead and bite your tongue.
Okay, I cannot do that. but I call you one day, oh no, I'm over in Walton County. I got to fly to Miami. I'm doing this, I'm over here in this county. I got to fly back here. I'll have to call you later. That tells me this is true to your heart, something that you want to get out to the community to make sure that the lives are being taken care of, because we were talking earlier, when you lose one, you don't have another.
None at all.
That is it.
None at all.
And you also tell me with all of the research you're doing,
sure,
the younger women are being affected in higher numbers than we would imagine. And when I say younger, I'm talking about some women in their 20s.
Sure.
I mean, but tell me your heart about this, Dr. Justice. Why is it so? I mean, because you know, men, they do that, but this is a man that runs this street up and down every year to make sure that women know how you work with the health department to get this mammography bus here so they can be tested. Tell me, I want to see what I feel on the inside from you.
So, Sonshine, thanks so much for being here this morning. And with you, Dr. Wiley, we have worked together in a different place for different purposes, but nonetheless to advance the aspirations of people. I think people can do much without health. Right. That's why I'm in this bigger field of public health. But just briefly, I am a faculty member at the University of West Florida, as you indicated, and I do lead a project called the Northwest Florida Cancer Control Collaborative.
Okay.
The key thing there, I think, is the word collaborative, that last word. It speaks of the very definition of why we do what we call public health. That in 1918, somebody defined it as organized community efforts, meaning people of like minds coming together towards a common goal that they are trying to accomplish something. And here we have in Northwest Florida, and the state of Florida in large part, a big problem of cancer.
Right.
And this is a very high priority issue for the state of Florida, and I am in awe of all the resources that are now being deployed across the state. In particular, our area from Pensacola, Escambia County, to approximately, it covers the 18 counties, from here to about I-75. There most of the counties are very rural communities. Some of the communities have very poor economic living conditions.
Right.
Very limited transportation means. Those things of transportation and access to usable income or financial resources does limit people to a great extent in accessing life-saving preventative care like screening.
Right.
And so I have been working on this space for a couple of years now. Last year we were pleasantly surprised. The state deployed a couple of buses and they came to our region to do some screening.
Wonderful.
Which is very rare resource. And that was, to me, I stood up, I applauded that because that was a good realignment of resources.
But of course.
And this year they have done the same. And this year they even amplified the numbers of screening events that we're going to do in this particular region of Northwest Florida. We actually have about 15 events to do. And up to this date, I've done 10 events with partners
You've been
from...
moving.
We are moving. But again, I tell people sometimes, I am a Lutheran, born and raised, I bleed. Jesus walked.
Yes, he did.
So why, when I have a car, can't I go from Escambia County and go to Panama City? Why can't I go to Liberty, Wakala? The Apalachicola National Forest is a thing of beauty, often unseen.
Of course.
So
I
I
say
got
to you
there
though,
to say,
let me say this to you, but I'm listening to him because he loves what he does.
Yes.
And you can tell how he names 15 events they got planned. They've already done 10. So you've been moving because I've been talking to you throughout the whole planning.
Absolutely.
But the point that we're trying to make, and when you find some people that may be living with their living is a little bit poor. I'm just going to be real. They don't have the transportation. They think that there's not a means of them to get the testing done. And so therefore, with what you work with the health department and all this, you've gotten this together so you can bring it to them. And anybody can find a way to come up with all the road. To get that testing done for you.
Absolutely.
And then if you have insurance, if you do not have insurance, you can still get the test.
Right.
Absolutely. And the point that we're trying to make for you today, ladies and gentlemen, if you know someone, if you have a younger person that you know that have not been tested, take them out, let them go by and do it. Because you never know. You never know. And so I want to flip over to Dr. Wiley. Because Dr. Wiley, I tell you, you are a picture of strength.
Thank you.
You are a picture of strength.
Thank you.
Because when I found out, you didn't stop. You never would have known if you had not told me. And I say that's a picture of strength, and I'm saying that so people can realize with here and here, you can do anything just because you get that word. And I want to go to you when you found out. How did it affect you and cause you to keep going? Nobody would have ever known that Dr. Wiley hadn't said a word. How did you do that?
Well, I think first of all, thank you for the compliment. I think it was scary, it was shocking, it was unexpected when I heard that I had breast cancer. Because when I went in for my mammogram, I expected to get the same result I'd always gotten.
Everything's fine.
Yeah. And so when it wasn't, when I heard the doctor say, actually the radiologist said, we might need to biopsy this. There's a spot or what have you. And I thought, well, I have dense breasts, no problem. Right. So when I did go back and in fact found out that it was cancerous, and then of course from there you do see the oncologist, the cancer doctor, and just sort of talk about what are the options, what do we have to go through, what are the next steps. And I think for me, it was first believing that I was going to get through it. I guess I was, I believed enough to believe that I would be okay.
Exactly.
And so just weighing what the options were, and for me, I opted for the mastectomy of my right breast. And it was caught at an early stage. But I think what it reinforced for me is the importance of getting the mammograms, doing the self-examination, all of that. It was reinforced. It's something that's real that we really have to do.
Absolutely.
Because on my own, with the breast self-examination, I would not have picked it up. But the mammography did pick it up. So it's important that we, what Dr. Mbito is doing, it's important when we have those mammograms and then get to talk to the physicians, figure out what the next steps are, and then you start taking the steps that you need to take. We cannot, in the midst of a diagnosis, decide that we're going to put our heads down, we're going to ignore it, and it'll go away, because it won't go away. It's not going away at all. The other thing that was so important for me was to have someone to share that journey with me. So I actually had a person who walked the journey. We were diagnosed 3 months apart. And we both were at the same church. So we walked the journey together. We started an online support group for breast cancer survivors, and we ran that site for 6 years. And in doing the online conversations, it gave women from all over America, because when you do it online, you can connect across the board. And when you stated earlier that it's not just about people who are 40 to 70. The youngest one in our group was 29 years old when she was diagnosed with stage 4 breast cancer, and she was pregnant. And I'm here to tell you, the baby's fine. She is fine, and in fact has had a second child since then. But getting the help that you need, and then having other women and men, because men also get breast cancer, but having others to support you. And when things happen, you can ask them, hey, have you all ever had A, B, or C? They lean in and say, oh yeah, that happens, and you'll feel this and what have you. That for me has been just a source, a great source. And in fact, I'm still connected with the local Pensacola Breast Cancer Association. I am an ambassador for that organization.
That's what I'm talking about.
And we raise money each year. Why do we raise money? So that women can get the mammograms at no cost. At no cost. So if you live in the Pensacola, Escambia area, and I know Dr. Mbito works in other areas, but my knowledge is specific to this community, we've got you covered. So we just need to know how to reach out and ask for the help that you need.
And you know, I gotta say, as you were talking, Dr. Wiley, I was thinking, I remember when I got a phone call from you, you did not say why. You were hosting an event. You asked me to step in. But what I'm trying to say is, you see, the way you handled it, I just thought, okay, you had to go do something else, you know what I'm saying? But that's strength. And you didn't put it out there, and then later on, you told me what was going on. But I never would have known, because you went and got with people. I could not be that person because I haven't been there. And I think with you, Dr. Wiley, you are just, well, like I told you, the first time I heard you, I said, who in the world is that lady? No, Dr. Justin, when I heard her, I was at this thing, I said, who is that? She is so phenomenal in so many ways.
Thank you.
And she is such an example.
Thank you, Sunshine. Thank
you. No,
you.
you are an example in so many ways. Even with what you've gone through with this, what you're sharing with people, how you reached out. You find people that you could talk with all over the world that could relate to what you're going through, and somebody else there could help you. Come on, somebody.
It is.
And Dr. Justice,
yes, ma'am.
I even tell Katie, my girl that works here with me, she's my ears. And I tell her, I said, I have never seen a man. I said, sometimes I don't understand what he's saying. But I love you, Dr. Justin. I love you, Dr. Justin. I really do. I thought I turned it off. But I thought I would say, you ever hear me when I'm talking, I go, huh, what you say?
Yeah. Many times. You are not the first one. There were many
but it's
Americans.
the way that you do what you're doing, and with how you teamed up with the health department. Talk about that part. How you got that connection there, so we can get the bus here and get everybody.
What I started off with is a small contract from the state so the state gets funding from the federal government.
Right.
Because the federal government and the state level officials, they are all concerned about particular people that don't have insurance.
Of course.
If they don't have insurance, they don't have the ability to have a primary care provider, where oftentimes that's the place where persons who are health conscious may end up having that discussion and end up going get a mammogram.
Okay.
But folks who don't have that, they don't have
Exactly.
the ability to. So there is what is called in Florida, the Florida Breast and Cervical Cancer Program.
Right.
That's one of these yellow cards that people see sometimes at their churches or sometimes at the community center, and may not necessarily communicate a lot, but there is a whole lot of stuff in here. Because when a person contacts this office at the health department, they register with that group. They screen individual to make sure they meet the eligibility criteria for financial income, annual income, and so forth. They are the experts on that. And I work with them, and I always move that answer to them.
Right.
But it's a program that I always promote, because this is the way to get into the building.
Exactly.
That is the mammogram screening services. So that's how I did. And then I write grants also.
You do what?
I write some grants.
Okay.
And then I get some smaller grants. And I created also partnerships and collaborations with other people across the state and across the nation. So I drive, just Dr. Wiley suggests or says, she connected with people nationally. Because you can imagine, in a country of 340 million people, there are so many cancer survivors. And if you were to tap into that larger market, instead of just the 350,000 people in Escambia County, now you have a question of support system,
right?
Emotional support.
That's right.
It may give you ideas on how to really adjust areas of your life, there's structural settings, environment at home, so that it is conducive to the new challenges. Because when a person is diagnosed with a cancer, breast or any other, that is a heavy load.
Of course.
And so having that, I love that when you mentioned, I wrote it in the note on my notes about social support system. Who takes care of this person?
That's right.
How do they, do they confide to their deepest thought?
Exactly.
Because I have a phrase about voices from the deep.
Voices from the deep.
Do you hear their voices? Because that's the voices from the depths of somebody's heart, how they truly are feeling.
Exactly.
They need to be able to empty that so they can release the pain.
Of course.
Yeah, so and that's how I do. And I communicate, I also collaborate with groups like Hope and Health, Community Health Northwest Florida, Penn K in Panama City. And there is a new other FQHC, Federally Qualified Community Center in Walton County. Big Bend AHEC,
Lots
West
of
Florida
resources
AHEC.
that are there.
So we have to, and that's it. It's not just on me, I think it's really the mosaic of this community engagement, community participatory in this process.
Right.
That is about the lives and well-being
saving
of
lives
people.
too. I mean, because you never know. You never know.
Absolutely.
You never know.
Absolutely.
We got to run and take a break, but look, we're going to come back and talk more with Dr. Justice and, of course, Dr. Wiley about this mammogram that's going to be here on the 21st. I got to write this out, right? Got to be here on the 21st, and we're going to tell you where and how you can call today to get your testing pre-done. I mean, get your screening pre-done for your payments if you got to pay or if you need assistance, right? We'll talk about that when we come back.
We'll talk about that one.
Stay with us right here on Sunshine's Corner.
For 75 years, we've been caring for families, creating jobs, and working to build a healthier community. This is your home, and ours too. We're honored to be the trusted partner in your care. Baptist Healthcare, here for you then, now, and always.
At FPL, we plan for storm season all year long. We're strengthening poles to better withstand severe weather. We're clearing lines to improve resiliency, and we're constantly training teams to act at a moment's notice. Because we're always working, always preparing. So when storms do hit, you can count on us. FPL, working for you every single day.
Step into your hometown boot store right here in Pensacola, Florida. The largest selections of Western boots and attire, including our own style of custom Anderson bean. The boot store also carries a great selection on workwear from boots to fire-resistant clothing. When you're looking for authentic wear, accompanied with authentic service, show up at your hometown boot store where you're more like family than you are a customer. And remember, the savings and selection are found behind the big red boot.
I'm Kathy Holsworth, Artistic Director at Pensacola Little Theater. Join me on the first Monday of every month at 7 p.m. for the Center Stage, where me and my artistic friends talk about all things on the stage and at the Clark Family Cultural Center. Join us, won't you?
Early detection saves lives. The Florida Department of Health and Escambia County's Regional Florida Breast and Cervical Cancer Early Detection Program is hosting a mobile mammography event on Wednesday, May 20th from 8 a.m. to 5 p.m. at 1718 East Olive Road in Pensacola, Florida. Free or low-cost mammograms will be provided to eligible women 40 to 64 who do not have health insurance and have low income. Walk-ins are welcome. To see if you qualify, call 850-316-2706.
Because people, good morning, and welcome back to the hottest spot in town. I get to talk about things, you know, because it's so important, because I want people to realize that with me and my beliefs, I'm a strong faith walking woman. And when you are lifing, things happen. But the first thing I think when we find out that God places avenues so we can get the help that we need, let's take advantage of that. I think his strategic planning is always there for the betterment of us because he loves us so much. And I say that because with the fact of, and I was just asking Dr. Wiley about the fact of when some people, and I can imagine when you get that information, how you process it.
Yeah.
And is it that maybe some people are afraid to hear that?
Yep.
They don't want to go to the doctor. Well, if I got it, I just don't want to know.
Right.
Right.
And so they keep on, and they go and they go and they go, because that's their way of dealing because of the fact, and it may not just be that they don't have the finances, but it's just the fact they don't want to hear it.
Right.
Yeah, I mean, I'm sure you've had, I mean, with the fact that you work in this so much, Dr. Justice, that there are people that happens to that way. Because that's just hard, got to be a hard pill to swallow.
That's human nature.
It has none. And with this, now I want, there's a phone number that's on the screen that people can call, right? If you're gonna put that up on the screen in just a second at the bottom, I put it up there for on that flyer. There's the flyer. You see that phone number on the bottom of there? 850-316-2706. That's the number they can call, right?
Yes.
And if you are at home sitting there, get your phone and just take a picture of that. And come on, do it, get her up. Don't spill your coffee, go on to the TV and take a picture. And have that.
Thank you, Sonshine. They have to take that picture. I think one of the most intriguing thing about it is, because I've seen her, the lady at the bottom of that page on the left corner, her name, I believe, is the Heat Wave. She will be in town.
Okay.
Yeah. She's a beauty.
Wow.
She's a beautiful thing.
The lady that cut the spot, that did the commercial for him, I called her, she's a survivor.
Yes.
And she was so happy.
Oh, yeah.
She said, anything I can do to help. I mean, very, 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 she came down and knocked it out like that because she just wanted to do something to help because she understands. And when we talk about things like this and sharing this information, we know that life with some of us I'm referring back to the younger people because they're living so fast. How can we convince them? If you ladies take that, do it yourself, you know how to do it.
Yeah.
If you feel anything abnormal, go get some help. If you don't have the fun, come to this event coming up on the 21st.
Right.
It's going to be where? Olive Road, right?
We'll be on Olive Road, right by the Health and Hope Clinic.
Exactly.
That'll be the second time the bus will be parked there. Last year it was parked there for the whole day, and it was a very productive day. I anticipate this year is even going to be bigger.
But of course.
So we do encourage, and I think just your point about the younger folks, I preach to that group of folks especially, because they're the people that think like, I'm too young, that's for old people. No, this condition is really showing its ugly head. In 22-year-olds, cases are being documented. And I've heard now recently of a case that was actually less than 20.
Really?
Now, how can anyone explain that? There are a lot of, because we don't have a single thing that says this is what causes it. There are so many things that come together to trigger this abnormality. Wow. And we have to heed the message about mammography saves lives, early screening. And the other beauty of the bus coming here this year, which is really for the state health office in Tallahassee to be commended for, is to include not just breast cancer screening on that day. The folks coming there that day will have the opportunity even to be screened for cervical cancer. There are zip codes and census tracts in Escambia County that I don't even want to live in.
I got you.
Because I look at the number and I see the picture of the census tract is red because of cervical cancer.
Right.
Now, when you talk about cervical cancer and then breast cancer, so you have two things that that are on the same individual. That's not a good thing to handle.
But of course not. But of course, when it comes to, how can I say this, Dr. Wiley? When you find out on, let me ask you something else. When they get the test done, how long it takes them to find out if there's something that showed up?
I believe it's less than 3 days. They 48 hours. They get that equipment. The state did an incredible job with this.
So they contact the people if they find something.
Yes, they get a lot of most of that stuff. They have a good clear idea. This is a 3D digital machine. This is it is when something is there and he sees it, they are seeing.
Oh, they tell them right there.
They're seeing something. Then if it's something that needs to go for radiology and all kind of imaging, the more complicated one, then they'll tell you they have to go do this, but the turnaround time is not too long.
Okay.
Because all the people that are working on this, along with the team that in Tallahassee, that the images are sent to make sure we're helping and move the diagnostic process and get the finality of what exactly situation the person is dealing with is of paramount importance to the state.
Dr. Wiley,
go ahead. Can I just quick? So one of the things about this program is, why it's important, is when people sign up and be a part of this program, when they come to the screening and something seems abnormal, that the state takes over and helps with the payment for the cost of the comprehensive, more expensive diagnosis going for on that person.
Right.
But they can't take a person who was screened somewhere else and found to have some problem and then come through this program and get the benefit of the advanced diagnostic test.
Okay, so let me make sure I'm understanding right. Okay, so
yes.
if a person if they go there, we come and get the screening done. Yeah. Okay, I find out that they see something.
Right, and they're uninsured.
That's the initial screening.
Yeah.
So then this is the dot I'm trying to connect. Who's going to contact them to let them know what to do?
Yes. That is the key thing about this registration. Way early, because the ladies that are working right now from Fairfield, they are doing all the cross checks, making sure that when Miss Quinta Quinten comes next week, that her document, she has information about, if we find something, all those questions have been thought about, prepped for, so that when there is something, that individual is given a note, please, and the doctor, their doctor gets a note. This person has this issue.
Okay, so you're saying, okay, I'm going to be the devil's advocate.
Uh-huh.
I'm coming in.
Yep.
I don't have the funds to get the test done myself.
Correct.
I don't have insurance.
Yep.
I'm going to come in, I'm going to fill this out, I'm coming in, getting tested. Oops, they found something. Mm-hmm. I don't have a physician.
Okay.
I don't have a family physician.
Yep.
So what are they going to do? How am I going to get the help now that I know that I've had now that something is there? What is my next step? Let me tell you what I'm saying. I hear about the screen, the name and that, but I feel like I want to say, okay, here's Susie over here had the test done.
Yep.
Susie found out there's something there. Susie didn't have a primary doctor. Susie didn't have anything. So where is Susie going to go when she's here in Pensacola?
She gets referred. This program has physicians, local areas in this what we call Region 1, Region 2, Region 3, and there is, if the person doesn't truly have, they are sent. There is a place they are being sent to.
Okay,
Yeah.
here.
Yes.
Is it one of the local hospitals?
It's yes, one of some of the local ones here.
Because
so they're given a referral,
Yeah.
and I know that some of your partners are our Health and Hope Clinic.
Okay, this is where I want to go.
We
Yes.
know we have
Okay.
Community Health of Northwest
Right.
Florida.
Right.
We have Baptist Hospital.
And
So the referrals are being made. So it's not like a person gets the screening and then is just
Nothing.
left to wonder
Right.
what's next.
Right.
Yes. So the partners that are already aligned with him would be the source
That's what
to
they would
which
send them
they
to.
are referred. Yes.
That's the quote I'm trying to get.
Yes.
And see, Dr. Dr. Justice, I be
See,
listening
I
to
told
you
you she was my sidekick.
No, because I want people to understand that this help is there for them.
Yes.
And I have been, now Health and Hope, I just think they're so good.
Yes.
I mean, Baptist, I've worked with them with their mammography for years. And I say that because over at Health and Hope, I went over to Dr. Erin. She's the best. I mean, but the way that they talk about how they take care of people. And I'm saying that so that our viewers will know that when you find out there's something wrong, that there is help is on the way.
Yes.
You got somebody that's going to help you.
Yes.
And Dr. Wiley broke it down because I said, oh, okay, she broke it down for me. But when, like Dr. Wiley, when I'm going to take a break. I want you to think about this when we come back. I can remember when you were going through your journey. After that, and the next event, you were right there on stage.
Yes.
And nobody, then, I said, look at that. But look, we're going to talk about that. We're saying this because I think all of these dots connect to make it stronger for you. If you don't know, find out. Then you know that there's help on the way. We're going to tell you just how you can get it right here on Sunshine's Corner.
You finally found the perfect car in racing blue. You even got them to throw in the LED fog lights for free. Auto Owners insures your car because some people never learn to parallel park. That's simple human sense.
Ask the Messick Insurance Agency in Pensacola if Auto Owners make sense for you.
Keep going. More. No, stop!
I'm Emily Echeverria, Marketing Communications Director for Council on Aging of West Florida and the host of Coming of Age. Watch our show to find out what we're doing for our seniors and their families, and hear from area experts and local business owners about their programs and services. Want to help? Find out how you can work with us to bring a better future to our seniors. Watch Coming of Age, 3:30 p.m. Wednesdays, only on Blab TV.
And welcome back to the hottest spot in town. This is Sunshine's Corner. We're talking today about breast cancer awareness. And I want to bring up this fact right here. First time I ever found out that a man had breast cancer, and men, yes you do, so get tested, was Richard Roundtree.
Mm-hmm. Richard Roundtree.
Yes.
Okay.
Shaft.
Mm-hmm. Yeah.
The first one who did Shaft.
Yeah.
Richard Roundtree. And when he came on TV and told them about, he had breast cancer, but he found it early.
And you're like, what is that?
And I said, oh God. And I did not get to meet him, but I had the chance to talk to him on the phone. But he explained, I had him on there, but he was explaining that to me and how important it is, because before him, it didn't sink with me that men could have breast cancer.
Absolutely they
And
can.
so we wanted, you were talking about something, you went to a barbershop and how important it is that you get the men to be open-minded as well.
What? I mean, I challenge men in a certain, and I like to challenge them when the women are there, because we got to dispel this myth among men. So part of what I now do is I do prostate and colorectal cancer as well. I promote that, and of course cervical cancer. But men don't seem to think. But then you see some guys at the mall or at the store, like, man, look at his boobs. Right?
Wait,
but then they
look at his
think
what?
Boobs. Then, but they think.
Wait a minute.
No, let me see. That's the deal.
Okay, look at his boobs.
Yeah, my deal is I'm gonna tell you just exactly as it is. Okay. Because when we start beating about the bush and we tell each other half truths never become truth. By the way, they always remain just a fantasy, just a lie. Let's tell each other the truth. Exactly. Man gets breast.
Okay, I'm gonna ask you a crazy question.
Yeah.
No, and I'm not trying to be funny. Okay, a man with man boobs have it easier?
No.
I mean, so.
No, that tells you when they try to tell you that well that's just for girls. No.
Oh, we got a call. Somebody on the phone with me. I'm sitting here just going crazy. See, you got me laughing. Okay. I'm very serious.
Yeah.
Okay, let's see who's on the phone.
Absolutely. Thank you.
Good morning. Let's see. Good morning.
Good morning, Sunshine.
Good morning.
This is Nita. Welcome. How you doing?
Hey,
good morning.
How are you, love?
Hey, Dr. Wiley.
Hey,
Dr. Justice.
Good to see
you. Hello. Good morning.
Good morning. I can't pronounce your last name, so I'll get back with you on the correct pronunciation.
I do the same thing. That's Dr. Justice, okay?
Dr. Justice. I just want to make a comment on this program this morning. It is well needed, and if the lady or gentleman doesn't take advantage of this free program, something is wrong.
Mm-hmm. I agree.
Now, I get that's right. I get my mammogram every year.
Oh yeah.
And as a matter of fact, I just got my results in mail a couple of weeks ago, saying everything was good, and from the Baptist Hospital ladies, women's imaging section, But I just wanted to comment on this program. It's a good program, very knowledgeable.
Thank you.
And like you said earlier, when you see that big C, when you're told about the big C, that's not something that you can turn your head around. You have to take action. So before you get to that point, they need to take advantage of this program.
Exactly.
Yes.
I tell you, Nita, you always there, girl. You always there with the right things to say to help.
Yes, thank you.
Well, thank you, Sunshine. It's just a good program, and I'm here listening and taking pictures, and
and we're gonna pass them
out. That's right, so I can pass them on. And Dr. Wiley, you were correct. I've been spelling your name the way I wanted to spell it, but I got it now.
Oh, thank you.
I got it.
Thank you.
Okay. All right, love.
All right, thank you, sweetheart. Thank you for the program.
Of course. All right, bye-bye. Ladies and gentlemen, I tell you, that girl right there,
yes.
I love her with a perfect kind of love.
Yes.
I mean, when it comes to supporting the community, to be out there and advocate for the community for the rights,
yes,
that's Anita Welcome.
Yes. Yeah. Yes.
And when you say a supportive woman, she does. She's a veteran.
Yes.
She does so much for the veterans. And it's just that's what I think what it takes for the community. When we put our resources together, connect the dots, there's nothing we can't do.
That's right.
Absolutely.
That's right.
There's nothing that we can't do.
Absolutely.
But the fact of it is we got to take advantage of what Dr. Justice walking around here all this and gas $5 a gallon, riding all over the city to make sure that you're taken care of. I commend you on that.
Yes. Yes.
I do. Now, what you were saying about the men with the big boots?
Look, men need to also to be thinking about that, because what we know is, it is when a person who is the child of a cancer survivor, their risk for developing cancer is higher.
In the men as well. So if his mama had it, he can get it too.
Yes, they came from the same womb.
Right.
They came from that woman. They got to be thinking their risk is not, they are not scot-free.
Right.
They got to be thinking about these things.
Exactly.
Because along with that genetic predisposition, to what degree we don't know yet. I can't speak to that level. But I can say, because they are the child of a person who had cancer, means they're coming from a family that has this gene that can result in this disease.
Okay.
But then they're coming to a world that is laden with all kind of carcinogenic environmental toxicants.
Wow.
And we have food sources that foods are just
food.
Oh yeah, I mean
food.
And I think it's important what Dr. Mbizo is saying.
You got his name down to a science.
But I've known him over 25 years.
Okay,
so.
Dr.
But what I was going to say is so important, the things that he's alluding to. Just some basic things that we need to know is that what he said is, and it's true, it's not limited to a particular group, a particular age, none of that. So hear what is going on. Talk with your family. Did your grandmother have cancer? Did your aunt have cancer? What about your sister? Whenever you need to know those histories, right? So sit down and have family discussions. Don't let it be something that you put in the closet.
Oh, God,
Bring it out and have the conversation.
Exactly.
And then when you're going through the treatment, speak honestly to others who are asking you questions. Tell them what it's like.
Right.
I had a niece this year diagnosed with cancer, both breasts, double mastectomy, 50 years old, just turned 50.
Young.
And then her mother, 4 months later, diagnosed with breast cancer. So that's sort of a weird situation there.
The daughter had it first, then mama.
And then mom. And so this is my sister-in-law and my niece.
Right.
So the whole point is, what did they do? They called me. I spoke truth to them. I spoke about what the journey is like, because we try to be so stoic, but this is information that could help someone else. And when someone asks you about what you're going through, tell them. Am I saying go out and advertise? I'm not. But I am saying be approachable, speak honestly, and within your family, have conversations around breast cancer, and you also said some other cancers, the cervical cancers. When cancer is something that's a part of your family history, you want to share that so that others know how to prepare.
And that person under you will know as well.
Exactly.
You said something I think was very important. You said that when you have it, you share it with people who have gone through. There's the one that can really be their shoulder for you, because they've been there, done that, got the t-shirt.
Right.
Don't just advertise it. You want somebody that's going to understand you, that's going to help you through your journey. Because sometimes I believe that I'm such a reserved person. I mean, I told you that one time, I just me, myself, and I.
Yes.
I mean, I'm because I am Dr. Justice, me, myself, and I.
Yeah.
It's not too many things that I share.
Right.
Yeah.
Right.
I mean, I'm not, but I believe like if there are people I have in my circle that I know if I needed to,
Right.
I could.
Yes.
Exactly.
Yes.
I know I
Exactly.
could.
Yes.
Yep.
And I'm saying that for people who are sitting there, should I? Yes, you should. Ask somebody today about your family tree. Ask somebody today about a person that you knew in your family got sick.
Yep.
And then that gives you a leeway to go ahead and take advantage of what's being brought to you, that you can get the help that you need.
That's it.
And watch your diet. He mentioned diet, Dr. Mbizo. Sugar.
That's a killer.
That's a big issue. And this brochure that Dr. Mbizo has brought,
explain this to me.
It has a lot of cancer facts on it, and one of them that it talks about is what we eat. We want the fruits, we want the vegetables, we want to have a diet that's low in sugar. We want to exercise, not be stagnant. And it doesn't mean that you've got to be out running every day, but at minimum we can walk, we can stretch. So there are things that we can do to live a long, healthy lifestyle.
Exactly.
And
Keyword, get healthy.
Yes.
And you know, I say this because when people talk about sugar, I say yes, sugar is not our friend. And that craving that you think you have is just something that you can overcome when you know it's not good for the body. And I know a lot of us love fried food.
Sure.
Don't eat it all the time. You know, I'm saying be mindful how you do the portion controls. Learn how to know what this is. That's 5 ounces of meat right there. Just in your palm of your hand, that's 5 ounces. Know that. Know what a cup is. But don't always go get the white rice, get the brown rice. Change your diet to make that plate more. I have a plate and it has a color on it. When I first started to learn how to eat, that told me what to put in that section and how much would go in that section.
That's it.
But and I say this, ladies and gentlemen, and I'm really talking to our young people now, and I'm going to be absolutely as transparent as I know how. We need to really educate our young people on how to eat because I see so many that are obese. I'm for real.
Right.
But
and obesity is a risk factor for cancer.
And it's that's a risk factor for cancer. So what am I saying? I want to talk about that more because there are, when I say connect the dots, there are lots of things that we connect the dots from the table to the water bottle. You know what I'm saying? Drink the water. Stay away from all those fast food. Learn to make your hamburger at home with turkey. I'm just saying, we're going to come back and talk about that because I get wild when I talk about that because I love the fact that I learned how to do that.
Okay.
I had to learn how to do. I got to go to break first, Dr. Justice. I can't say your last name, but we'll be back with more right here on Sunshine's Corner.
My name's Kelly McLeod. I'm the owner of Bella Magazine. Bella is a source of uplifting and inspiring content for the women of Pensacola.
I think the magazine is just so thoughtfully done. There's a lot of attention to detail. The stories are really good.
You've got seriousness, you've got fun, education, fashion. It just encompasses everything.
Women are multidimensional, and so is Bella.
The Emerald Coast Utilities Authority's state-of-the-art materials recycling facility processes recyclables for communities throughout the region, lowering need for more landfills. This highly efficient recycling service accepts glass, paper, cardboard, plastics, aluminum, and more. But we need your help. Please make sure your recyclables are clean of garbage, food, and liquids. Also, please remember that plastic shopping bags, foam products, or yard waste are not recyclable. To learn more, go to livegreenecua.com.
From the efficiency of American natural gas and the dependability of nuclear power, to the strength of Florida's sunshine and the flexibility of advanced battery storage systems, we leverage a diverse mix of energy sources to power our growing state, ensuring reliable, low-cost power for your home or business whenever you need it. FPL, working for you every single day.
Well, I think it's all about local, and I'm a big believer in local. So I think anytime you can carry a message out locally, it's important. And I think it's anytime the person that delivers the service can also deliver the message, which is unusual. You have the people that actually deliver the project doing the talking, and I think that's a huge difference, and really makes a huge value difference for the consumer. So I'm really just so grateful that we have this local opportunity with Blab TV. My name is Quint Studer, and I am Blab TV.
Make some more bread. And welcome back to the hottest spot in town. This is Sunshine's Corner. We're talking about the mammography bus that's coming in on May the 20th, Wednesday.
Wednesday, May
8 to 5.
8 to 5.
Right there on Olive Road, next to Health and Hope.
Yep.
And you cannot miss it. We were talking about the things whereas what has a part in cancer. Alcohol.
Alcohol.
Smoking.
Tobacco use, yep.
Okay, what about the other alcohol?
What other alcohol? Alcohol is
I mean,
alcohol.
not other alcohol, I mean smoking.
What
marijuana.
about smoking? Oh, yeah,
Now, I hear people say that there is a thing that helps them to,
no.
that is a medical thing. Now, you can't get medical with that.
Well, there are a lot of debates about that, but we do know the evidence is indisputable that tobacco smoking is really a risk factor for a multitude of cancer types.
Yeah.
So you look at, even in the state of Florida right now, there's a program called Tobacco Free Florida. It is intended to really minimize the things that we can actually have control over. They are called modifiable risk factors for cancer.
Okay.
Tobacco smoking, we can get people into tobacco smoking cessation classes and work them through stages to eliminate the habit. The same way that we can do with alcohol as well, excessive alcohol use.
Okay.
For alcohol, which we always use even this phrase that we employ in public health, we call it moderation. Just like cakes, people love cakes. I am not a fan of cakes. I don't care. Yes, you can enjoy cake, but moderation.
You don't eat cake?
No, you just cake, moderation squared.
Yeah, please, everybody like cake.
Yeah.
Let me tell you my favorite cake, and I haven't had one in a long time. That's a coconut cake.
Oh, mine too. Oh my God.
I love coconut cake.
So I'm in bed.
Anybody bake me a coconut cake? Okay.
So you mean I'm in bad company here? Huh?
You taste that coconut cake. I haven't had one of them in so long.
Yeah. I think part of it is training oneself also over time.
Right.
I'll get a small piece of cake at a wedding, but it's not going to be bigger than that. It's like most of us, we eat a lot of red meat. Really, the amount of red meat you need in a week, the proteins you need for meat, red meat is about the size of a deck of playing cards. If you get that portion a whole once a week, you are sufficiently fueled. You're fine.
I found out from Dr. Aaron how long it takes for that red meat to digest.
Wow.
It takes a long time.
Yeah.
But now we got 3 minutes. Can you believe that? It's going already.
Yeah.
We want to remind everybody.
Yep.
We got a special show coming up about how to prepare foods and cook. That preventive part there too. Yes. But I want to say to you, Dr. Justice and Dr. Wilder, thank you so much for coming in to sharing this important information. And ladies and gentlemen, I want to invite you, if they will put that back up on the screen one more time, about the phone number, how you can call, the places where you can go and get the help that you need for this screening that's going to be taking place on Wednesday, May the 20th.
May the 20th.
There it is right there. And ladies and gentlemen, please call that number, and you see, once you plan ahead, you've got your spot reserved.
Yes, you do.
You don't have to walk there, just stand there. You got to stand in line to get to your spot, but yet still you already reserved.
The process is actually it doesn't take too long.
Right.
Yeah, 10 minutes, you are gone, you're out.
You done?
Yeah, you're done. They are working. That bus has 2 rooms. You come in, you check in, there's a space, rooms for, we care about the dignity of the individual.
Okay.
So there is a bus, the bus, not that I didn't, it was configured that way, but it's to preserve the dignity of the people. The rooms are appropriately configured, and I was pleasantly surprised and excited to see that, because that's one thing I care about, is the dignity of the people.
Of course.
Even though they're dealing with these
Potential everybody deserves that respect.
Dignity, respect, because that's the only way we can win the hearts of the people.
Absolutely.
To come up.
I agree. And thank you so much. And ladies and gentlemen, please make sure that you go out and take advantage of this. Now, this show will air again this afternoon at 6 o'clock. So we can have everybody, I'm going to put it back up. We got our YouTube that's going to come up after 12. And you'll be able to watch this show again today. So tell somebody you can get all the information. And men, please do not step back and say, no, this does not affect me, unless you know. Go out and get the test done as well. It won't hurt. I'll say that because doctor, every time I say that, when you said the boob, it made me laugh. Okay,
Yes.
But that's all good. But thank you for all that you do.
Yes.
All the work that you do.
Thank you.
Because you never stop. I have to say, since I met you,
Yes.
you never stop, and we need that. Ladies and gentlemen, it has been a fantastic show today. When I say information, knowledge is power. This is what I mean about when purpose meets power and conversation creates change. This is where you'll find it right here on Sunshine's Corner. On tomorrow, we got to go and come back. We've got another show that's lined up for you. We're going to be talking to a young lady that's, pilot school, Air Force, all of this to educate everybody on the things how you can do the same thing. But I got to go and I'll leave it with you as I do every day. Never, ever, ever lose your focus. Always remember this. As you keep God first, I guarantee you this, you're going to be a total success. So until 9 o'clock in the morning, know that I do love you with a perfect kind of love. Go out and tell somebody that you love them and mean it. Action speaks louder than words. Until then, I want you to know just how important it is to be tested. Don't let anybody tell you to bypass this. God gives us a gift. Let's accept the gift.
Amen.
With a smile. May the 20th, Wednesday, Health and Hope.
Yes.
Be there. Get your testing done. Bye for now, ladies and gentlemen. Have a great day, and we will see you on the flip side, as they used to say.
Yes. Yes.
Thank you so much, Dr. Justice, for all that you do. Dr. Wiley, you are a queen in our community. Thank you so much.
Sunshine's Corner, being brought to you by Quint and Richie Studer.